Good evening, doctors. Today we are going to do obstetrics and gynecology. So, if you are able to hear me and see the questions, type yes in the chat box. So let's begin with the first question. Thing is that obstetrics and gynecology is a very important subject as far as Neet PG is concerned. It has a weightage of 25 to 30 questions. That is almost 100 to 120 marks in the Neet PG. So let's begin with the first question. Zygote with zona pellucida reaches the uterine cavity by A. 2 days, B. 4 days, C. 5 days, D. 6 days. It is 4 days. The role of human placental lactation is A. Stimulate milk production, B. Fetal breast development, C. Growth of fetus, D. Endocrine regulation. Well, it is the growth of fetus. Most common site for implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. It is ampulla. Go to the description. There you will find a link. Just click the link in the description. You will join the WhatsApp group, which will give you the information about the 3-day Neet PG Breakthrough Blueprint Masterclass, which is to be held very soon. During which gestational age is peak serum HCG level attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, D. 25 weeks. It is 7 to 9 weeks. What will be type of presentation when engaging diameter is mento-vertical? It is bro presentation. What happens in a bro presentation? The engaging diameter is mento-vertical, that is 14 centimeter. Bro is the rarest variety of cephalic presentation, where the presenting part is bro and the attitude of head is short of that degree of extension necessary to produce face presentation. What happens in face presentation? In face presentation, the presenting part is a face, and the attitude of face fetus shows complete flexion of limbs with extension of spine. The commonest position is left mento anterior. The engaging diameter of head is submento-pragmatic 9.5 cm in fully extended head, or submento-vertical 11.5 cm in partially extended head. So the correct answer is B, bro. Most common cause of secondary PPH. If you have any doubts regarding any question, you can WhatsApp me directly on the given number 948-365-2020. And you can also WhatsApp me if you are feeling difficulty in any topic. I will upload a video regarding that. And if you are feeling any difficulty in any of the subjects, the 19 subjects, you can simply WhatsApp me on this number. So the most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. Cervical tumor. It is retained placenta. See, bleeding usually occurs between 8 to 14 days of delivery. Now, what are the causes of late PPH? Number one is the retained bits of cotyledon or membranes, which is the most common. Number two is the infection and separation of slough over a deep cervicovaginal laceration. Number three, endometritis and subinvolution of the placental side. So it is retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of LSCS is A 2%, B 4%, C 5%, D 8%, it is 2%. Subpubic angle is A less than 65 degree, B 65 to 75 degree, C 85 degree, D 110 to 120 degree. It is 85 degree. So the correct answer here is C 85 degree. Rule of Hasse is used to determine A. Age of fetus, B. Height of an adult, C. Race of a person, D. Identification. It is age of fetus. Hasya rule is employed in calculating the age of fetus by its length. During the first 5 minutes of pregnancy, the length in centimeter is square of the age in months. So length in centimeter is equal to square of age in months. So the correct answer here is age of fetus. Indication of acyclovir in pregnancy is A. Disseminated herpes, B. Chickenpox in first trimester, C. Prophylaxis in recurrent herpes, D. All of the above. It is all of the above. Human placenta is A. Discoid, B. Hemocoral, C. Deciduate, D. All of the above. It is all of the above. Heart flushes are experienced as a result of A. Increased noradrenaline, B. Decreased estrogen, C. Increased noradrenaline, decreased estrogen, increased noradrenaline, and estrogen. It is increased noradrenaline and decreased estrogen. Cephalic index is A. Biparietal diameter upon OFD, B. Biparietal diameter upon HC, C. OFD upon BPD, and D. HC upon FN. It is BPD upon OFD. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. MRKH syndrome is also known as MERCS syndrome, Mullerian-Genesis renal aplasia, cervicothoracic somatic dysplasia. MRKH is Mayer-Rokitansky-Kusteracki syndrome, has a karyotype of 46XX. So the gonads present are ovary in contrast to androgen insensitivity syndrome, where testes are present. The MRKH syndrome is characterized by congenital aplasia of the uterus and upper part of the vagina in women, showing normal development of secondary sexual characteristic and a normal 46XX karyotype. So the correct answer is D. Testis. Polyspermy is inhibited by which ion? A. Ca, B. Na, C. K, D. Cl. It is Ca. Maximum amniotic fluid is at A. 32 weeks, B. 34 weeks, C. 36 weeks, 40 weeks. It is 36 weeks. Fertilization usually occurs in which part of fallopian tube? Fimbrial end, B. Ampulla, C. Interstitium, D. Isthmus. It is ampulla. Physiologic change in leukocyte number in pregnancy is A. Neutrophilic leukocytosis, B. Lymphocytic leukocytosis, C. Neutropenia, basophilic leukocytosis. It is neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram, B. 600 to 700 gram, C. 800 to 900 gram, D. 900 to 1000 gram. It is 900 to 1000 gram. Urinary retention earliest in pregnancy is A. 10 weeks, B. 18 weeks, C. 22 weeks, 34 weeks. It is 10 weeks. Down syndrome is earliest diagnosed at 8 to 10 weeks, 10 to 12 weeks, 12 to 14 weeks, 14 to 16 weeks, 10 to 12 weeks. When is folic acid started in pregnancy? 4 weeks prior to conception, 8 weeks, 4 weeks, 8 weeks after conception. It is 4 weeks prior to conception. Term placenta weight to baby ratio is A 1:3, B 1:4, C 1:5, D 1:6. It is 1:6. Persistent OP position is most common in which pelvis? A. Android pelvis, B. Gynecoid pelvis, C. Anthropoid pelvis, D. Mixed. It is android pelvis. Pregnant uterus will compress ureters at A. Pelvic brim, B. Uterovesical junction, C. Diaphragm. It is pelvic brim.